review is about pemphigoid. Mainly, we're going to talk about ocular societal pemphigoid, and what are the clinical signs, how it will present in the clinical setting, right? So, the most important thing that you have to remember is that there is going to be persistent conjunctivitis, right? Whenever you are asked in the question stem, what is pemphigoid? Just remember conjunctivitis, persistent conjunctivitis, and subepithelial conjunctival bullae. These bullae, when rupture, lead to ulcerative and progressive cicatrization. So, constant and persistent conjunctivitis and subepithelial conjunctival bullae, which rupture and then further lead to cicatrization. Also, in the conjunctiva, there are going to be gray white linear opacity. So, there are three pathologies associated with conjunctiva, right? So, there is going to be persistent conjunctivitis, subepithelial conjunctival bullae, and then constant, there are going to be gray white linear opacities of the conjunctiva. Also, we're going to find the corneal epithelium, it is going to have some defects, right? And then what are the complications? Complications are dry eyes, symblephron and tyloblephron, corneal vascularization and keratinization and conjunctivitization of the cornea. So basically the cornea will be keratinized, conjunctivalized and vascularized. What is the treatment? We can use artificial drops, steroids and cyclosporin, or to prevent the keratinization, we can use retinal cream and tetracycline and antibiotics. But the most important treatment is the systemic treatment, right? This is the local treatment, the topical treatment. The systemic treatment, we have to remember three main important points. That is antimetabolites, dapsone and steroids. Sorry, 4 important points: antimetabolites, dapsone, steroids and IV immunoglobulin. So first of all, we're going to have antimetabolites, azathioprine and methotrexate, and then we're going to have dapsone, which is going to be diaminophenyl sulfate, steroids, and then IV immunoglobulin. So this was all about pemphigoid. What is pemphigoid? Pemphigoid is basically persistent corneal conjunctivitis with subepithelial conjunctival bullae that basically rupture and lead to further cicatrization. There is going to be the opacities, white linear opacities in the conjunctiva. There is also going to be the corneal epithelial defects. This can lead to dry eye, symblephron and tyloblephron, keratinization, vascularization, and conjunctivalization of the cornea. Conjunctivalization means that the epithelium will resemble the conjunctiva. The corneal epithelium will start to resemble the conjunctival epithelium. You would not want that. That's a pathological process. The treatment is local and systemic. Local treatment, we all know we have to give local steroids and antibiotics and have to clean the eye regularly. And to prevent the keratinization, the most important thing in this case is to prevent the we give retinoic acid, right? But in the systemic treatment, we have dapsone. We have just try to remember it by using ADS. So we have antimetabolites, dapsone, and then we are going to have steroids, right? And then ADSI with IV immunoglobulin. So that's all about pemphigoid.